Kia ora koutou katoa, ko manaia te maunga, ko hātea te awa, no whangarei aho, ko Kate toko ingoa. Kia ora and good morning to you all. It is a really great honour and privilege to be invited to speak on this panel, and I just really want to acknowledge my panellists, my fellow panellists, for their insights and their perspectives. I'm really excited about where we're going with this, and for the speakers this morning, all of you, thank you for your insight. I'm here obviously representing Grandparents Raising Grandchildren Trust New Zealand, and in so doing I'm representing the 4,080 member families we have on our books today. They live throughout New Zealand, from Kaitaia in the north to Bluff in the south and everywhere in between. But our members are less than half of the number of families who said they were raising their grandchildren at the last census 5 years ago. So in a sense, if I may, I'd really like to also speak on their behalf, because grandparents and other whānau caregivers are a group in our society who we've calculated to be raising over 20,000 of some of our most vulnerable children and young people today. These caregivers are the ambulances at the bottom of the cliff. It's because 3/4 of our member families tell us they're raising their grandchildren or someone else's child in the family because of their parents' drug use. More and more parents are unable or unfit to care for their children because of it. Around 70 new families join GRG for support each month, and in the last calendar year, 839 new families joined for support, which was up 13% on last year, which itself was up 24% on the year before. And let me tell you, our own internal member survey conducted last year told us that 86% of these families have identified methamphetamine as the catalyst drug that caused the breakdown of their families. In more than half of these cases, it was also both parents affected by meth. The next highest group, at 35%, being single mothers. This insidious and destructive drug is so endemic and so readily available that it has ultimately led to chaos amongst thousands and thousands of families nationwide over the past 20 to 30 years. And far from its use declining, we see its impact on families more and more, as I know my colleagues do. Families are torn apart because of it, facing despair, economic ruin, loss of jobs, loss of homes, even lives, mental illness, domestic violence, crime, imprisonment, and the devastation of the families. And it also seems from our internal member survey that where there's meth, there's also other drugs. And it's interesting to hear Lizzie speak about the experience with the young mum and so many in her walk-in centre, that cannabis is also an issue. 81% cannabis, our members are saying, is an issue. And in the words of a number of grandparents, anything he or she could get their hands on. What is highly disturbing is that there are also increasing numbers of children diagnosed with serious health issues and disabilities due to past trauma and neglect, violence, and the criminality that they've been exposed to while in the care of their parents who are using. Or for some, it's more lifelong disabilities and developmental issues caused by exposure to a plethora of drugs, environmentally in their homes, or exposure in the womb. The futures for far too many of these children look pockmarked by the sort of adverse outcomes we've all come to expect from this scenario. They'll have poor self-control, have poor achievement in school, exhibit impulsivity leading to unhealthy risk-taking, and that will lead on to more substance abuse, crime, mental illness, and in future more children in state care or grandparent care, higher imprisonment rates, and lifelong benefit dependency. But most of the children in grandparent care are lucky, lucky that they have their grandparents or someone else in their whānau to step up and care for them, love them, keep them safe, and to do what they can to provide them with the kind of home environment and guidance that can lead to positive outcomes in their lives. And there are many success stories where this has been the case. But even with the best intentions, these grandparents of children whose parents are addicts or substance abusers are really struggling to get help for the children affected by it, and struggling to get help for the parents who are the users. Because the reality is, and I know that you all feel this, is that they still care and they want to see the parents get well and become the parents they ought to be to their children. Our families experiencing this are desperate for support, for help for the user and support for the family. And as we know from many of the speakers today, there are far too many parents, guardians, wider whānau and friends who simply don't know what they're dealing with when it comes to addiction. They want to help, but so many are all at sea and lost to help in many cases. And too many of our cities and towns are struggling with increasing numbers of addicts. For some, there are no rehabilitation facilities, and for those that have them, like in Auckland, there are waiting lists that extend for months. To make what matters worse, the threshold to actually get attention and get admitted to a program of rehabilitation is too high. You've got to hit rock bottom, commit crime, or have suicidal ideation before anyone takes you seriously. We already have over 9,000 people in prison, and around 90% of them have a substance abuse problem. We need to do better. We need to get to them before they hit rock bottom and end up committing crimes and in jail. So when I'm asked what the number one priority unmet need is in the context of addiction in New Zealand, my first response, based on the responses and the requests we get for help, is for better resources to support the families and the support they need to get their addicted family members into effective rehabilitation programs. There are many, many good initiatives and programs, and for example, the therapeutic courts in Auckland and Waitakere. There are good results coming out of the Northern DHB and New Zealand Police through Te Ara Oranga. Of course, there are many programs and representatives here of programs that are working in the community. We need to better resource these programs and roll them out across the regions. I think it's important that we also focus on the cognitive behavioural therapy, and I'm using those sort of clinical words which actually really are better expressed by my colleagues on the panel actually, in the way in which they're working with people and the experience that they're having with users. But it's about being holistic and treating the whole person, getting them well mentally and physically off the substances, and getting their understanding and awareness to the very core of why they haven't made good choices in their lives and have used drugs or other substances and have been unable to comprehend at that time the cost of what it's doing to them and their family, and especially to their children, and to know that they have the power to change their lives. It also needs to be the kind of rehabilitation and education that is reinforced by effective support, counselling and education for the families to be able to support their family member in their recovery. That is what our families are asking for. On every level, it comes down to education, and it comes down to supporting the health and well-being of families. Aside from the criminal justice consequences for those who commit injurious crimes and offences while affected by their substance abuse, I believe the greatest opportunity for prevention and response to addiction is the recognition that it is a health issue, and that the addiction services and health professionals need to be properly resourced to treat and support users in their recovery. In that context, it also requires the robust support and involvement of the family, the wider whānau, caregivers, friends, everyone, to educate and empower them to get an insight in how to support their addicted family member. But it also goes beyond just the families of users. Our families across the board need meaningful education in our communities of parents, caregivers, grandparents, children and young people in our schools about the signs that someone may be in trouble and where to get help and education that supports children and young people to make good choices and empowers them to say no to drugs. Kia ora. Thank you.